Breathing a sigh of relief tonight, dozens of healthcare professionals from across the state came to the State House to protest House Bill 1004. A controversial amendment to that bill was removed today in the Senate. The previous version would have reduced payment from insurance companies to off-site hospital facilities for procedures. Dr. Jim Bean from IU Health Arnett was one of the hospital employees who attended. He says the amendment would have had negative consequences.
That see this as a direct impact on access to essential services for patients and their ability to continue to provide them.
We have to be very mindful that this could have a devastating impact and effect on rural as well as urban hospitals.
The change passed successfully with a voice vote in the Senate. The original purpose of the bill, which remains intact, was to make medical billing more transparent. Well, graduate students from Purdue's Department of Public Health got in action at the Indiana State House today as well. News 18's Anna Darling followed the group as they lobbied for various health-related bills to lawmakers.
This group of Purdue Masters of Public Health students wasted no time on Monday at the Indiana State House.
We're lobbying today for certain bills that need to get passed.
This is Shakina Fletcher's first time lobbying to legislators.
It's just quick in and out minutes with them, but it's a great opportunity. It's a learning experience for all of us.
Fletcher was part of the group who spoke with State Representative Chris Campbell, who shared how much she enjoyed talking with the students.
Sometimes they're the experts. So we need their input, and we want to make sure that we're representing our constituents.
The bills on their agenda had a wide range, from a rights for sexual assault victims bill to a mental health services bill, lowering the colon cancer testing age and growing substance use recovery services.
Just different things that we think are important for us as people in the state of Indiana that should get passed.
Group leader Lauren Murphy says these advocacy skills will help the group in the future.
We want to make sure our students at Purdue are engaged with these issues. They are being informed as Masters in Public Health students, so that when they become public health officials or professionals in nonprofits or at the state level, that they know how to engage on these issues.
And when students weren't talking to legislators, they were writing them letters. But Fletcher says the FaceTime they got with leaders was key.
I like to talk to people one-on-one because you get to meet the person, get to know who they are, what their motives are, and why it's important to them.
Anna Darling, News 18.
Well, this was the first time Purdue MPH students lobbied at the Indiana State House, but they hope to continue that program in the future.